Hello, everyone, and welcome. Thank you for tuning in to the first Kaiser Permanente and Special Olympics Southern California Health Wellness Discussion. My name is Calvin Lyons, and I'm the President and CEO of Special Olympics Southern California. And I'll tell you a little bit about what we'll discuss today. One of the things we really want to talk about with Dr. Rubin and our guest, one of our special athletes, Manasa, is a COVID-19 vaccine. Sort of give the information, the rundown, so that people have the facts and they can make an informed decision as to whether or not to take the vaccine and to prevent themselves from getting sick. I actually took the vaccine on Monday, so I am completely vaccinated and ready to rumble. As soon as the gates open, we're going to get back to activities and have a blast. So I'm going to turn it over now to Manasa. Manasa, your turn to be a star again.
Thank you, Calvin. I am so excited to hear that SOSC and Kaiser Permanente are continuing to collaborate together to work with athletes like me. It's really amazing that that they're coming together and working with people. The doctor I go to, her name is Dr. Keller. She's really amazing. And she tells me that she really cares and she wants me to be healthy and happy, even sometimes when I refuse to listen to her.
Well, it's always good to listen to your doctor, and we have a great doctor on Dr. Rubin. Dr. Rubin, thank you. And I'll give you a little bit about Dr. Rubin. Dr. Rubin is our Chief Medical Officer, and he works for Kaiser Permanente, and they're our official health partner. We began a relationship with them many years ago, and we're actually in the second sort of run of sponsorship, a 3-year partnership, special partnership with them, where they are giving all of our athletes, volunteers, and anyone who wants to be healthy a chance of getting better and staying healthy. So Dr. Rubin, thank you again for the Kaiser Permanente partnership with Special Olympics Southern California and for all that you do personally to help us stay healthy. Tell us a little bit about your work here.
So thank you, Calvin, so much, and thank you, Manasa. And hopefully, Manasa, I don't know if you've ever needed to see us at any games. Hopefully not, because when we are out there at the different events, the different sporting events, we really hope we never see the athletes. We don't want them to get hurt or be sick. I mean, our role is to be there as fans, but hopefully you've never had to come see us. Any of the physicians we have volunteering and nurses we have volunteering at the games. But if you ever do, we're there for you. So we want to make sure you understood that. And then you can always just drop by. You know, we're happy to have visitors come to our medical tent and our medical areas. So anytime you're out there, we look forward to seeing you when the events start up again. I started actually working with Special Olympics just before about a year or two before the World Games in 2015, and I helped run the Southern California Special Olympics World Games out of Los Angeles, and we had amazing response from our physicians at Kaiser Permanente. We had over 750 physicians volunteer to come out on their own time and take care of athletes from all over the world, and it was just a natural thing for us to continue this partnership afterward. And we often use the word partnership more than sponsorship, because we really want to be partners, work together on all of the things that make Special Olympics special and keep the athletes safe. So I had the opportunity to, after our first run about 3 years ago, to be chosen as the Chief Medical Officer, kind of presented by Kaiser Permanente to Special Olympics. And with the announcement of our new 3-year partnership, they've asked me to stay on in that role. So I'm really happy to be doing that. My background is I'm a family physician and a sports medicine physician. So I take care of all kinds of athletes, from high schools to colleges, to youth sports. And of course, Special Olympics is really special to me as far as being able to take care of the athletes the same way that we take care of all the other athletes. One thing too, just to explain, because as people watch this, I'm actually talking to you from one of our vaccination sites that we have set up at Cal Poly Pomona. And so you see behind me, I have Dr. Fauci looking over my shoulder. We have him here in our mass vaccination trailer here that we're kind of working out of. You'll notice I don't have a mask on right now. We might have a chance to talk about masks because I'm in a room basically by myself, so we can do that. But we'll talk about masks a little bit later too, I think. So thanks for the introduction, Calvin, and thank you, Manasa.
Indeed, and just a quick thank you too. I have so enjoyed our partnership and the things that you all are doing to help us return to activities. And you mentioned to Manasa that there may not be opportunities for her to come and see you at the events unless she's injured. But there are also opportunities that you provide for our Healthy Athletes program where you do screenings to help determine if an athlete's feet, eyes, teeth, or et cetera, are healthy. I wonder if you could share a little bit about that.
Yeah, I mean, Manasa, do you want to start?
I'm here.
Healthy
Yeah.
Athletes, go ahead.
Okay, so for Healthy Athletes, one of the good experience was that they gave me, like, when they were checking my eyes, and they gave me like that. They gave me those one of those free glasses, but it was not like this one. It was like a different one, and it kind of helped my better with my kind of like my eyesight. But I might have to go back again.
That's good. You know, and helping with eyesight is great. I didn't start wearing glasses until my senior year in high school, and I didn't realize I couldn't see. So I'm glad that you have that. And I've worked with some folks who determined that leaves on trees were individual. And that's always powerful for me when a person realizes how important it is to see well. So Manasa, I like your glasses too. They're
Thank you.
You're welcome.
I like them too, Manasa. So we were talking about them earlier a little bit before the camera started rolling, but they're very nice. So, Healthy Athletes, you know, that's a part, you know, me as a sports medicine physician, I'm used to being on the sidelines and taking care of injuries and that, and have really enjoyed becoming part of Healthy Athletes. A lot of us at Kaiser Permanente have become doing MedFest. So we do the physicals for the folks before as we need to, and then help wherever we can with the other areas of Healthy Athletes. I found that to be one of the things I got a chance to learn the most from, and to really enjoy spending a lot of time. I spent a lot of time in Healthy Athletes at the World Games, and spent a lot of time in Healthy Athletes whenever we have the events. So I think it's a great opportunity for athletes to get their care in a place that they're comfortable and get screened in places they're comfortable. So I really appreciate the work Healthy Athletes has done, and I really look forward to continuing to do that kind of work.
Indeed. Again, thanks to you and the Kaiser Permanente team for the respect of inclusion and participation for the athletes, and how you engage and involve your doctors with our athletes and our staff. We love it, and we thank you so much for all that you do.
You know, it's been a pleasure, and it's actually rare that I talk to any physicians who were involved in any of the games. I happen to be talking to a fair number of them recently who are asking when we can get back out. So we're just as raring to get back out and see the athletes as the athletes are to come out and participate again. For us, it's a lot of fun being out there with the athletes and the staff and interacting. So I have a bunch of physicians who are ready to go with anything we need to do.
Thank you. And Manasa, did you have any other questions for Dr. Rubin? And I wonder if he had some for you. I think you guys are going to talk about why you decided to get vaccinated.
Okay. Well, I want to ask for what do you guys by working together between Kaiser Permanente and SOSC, what do you guys hope to accomplish?
I'll let Dr. Rubin start.
So I think sports are a great way for the world. I mean, to do things, to learn leadership, to learn skills, to learn how to interact with others. I don't think there's any better venue to do that than sports. And as I said, or a little earlier, is that we as physicians want to go to the sports, and we really don't want to have to do anything. It's not that we're lazy or anything like that. It's just that we don't want to see anyone get hurt. But we want every athlete to have to feel safe out on the playing field. And if they do get a minor injury, how quickly can we get them back in to safely participate? So that's been our goal all along, is to make sure there's safe participation in sports. So that's what all our doctors are looking forward to doing again.
And thank you. And I would add, Manasa, that we also want to be athletes for life. How do you make sure that in this inclusion revolution, that we're making sure that people with intellectual disabilities have the opportunity to be strong and healthy? Because there's also an impact on the mental awareness, mental health, when your body is healthy. And I want to be an athlete, not an athlete, a person who continues to build and stay strong, because it's important. Even when I took my vaccination this past Monday, it was amazing how, so to me, it was painless. The guy said, "I'm done." I said, "Really? Already?" I didn't even feel it. And not that everyone will have that same experience, but I'm still encouraging people that no matter what it takes, to make sure that they position themselves to be ready to get out and get active. And I think the vaccination is an important part of that. So again, thank you to both of you for all that you're sharing today.
So let's talk about vaccines a little bit, since you brought it up, Calvin. First of all, vaccines are really helping a lot, and even more than we thought they might be when we started to develop vaccines. I say we, but the medical community started to develop vaccines. I can't tell you how incredible it is that a good vaccine for a new disease came out within a year of the disease starting. And that doesn't mean that scientific shortcuts were taken. That means other shortcuts were taken to help get the vaccine manufactured. Normally, a company will work on a vaccine and then they won't make any of it until it's been tested and gone through all of the testing. What happened with the COVID vaccines is that they were testing them as they were manufacturing them. So they held them aside, and if there weren't any problems with the vaccines, then they would just destroy them. So they really invested millions and millions of dollars on the chance that they would work. And they used some good science to create these vaccines. They've been created for other diseases before. So it's not like it's something brand new. And a lot of people I know were concerned that this was too fast. But the fast part was changing the way they manufacture it, less than it was actually creating the vaccine itself. There are 3 basic vaccines available in the United States right now. 2 of them are called mRNA. It's scientific, but it's just a kind of a newer technology. It's a messenger RNA, and it actually tells the body to prepare for a virus before it gets there. So it's telling you to do that. Those 2 vaccines are made by Moderna and by Pfizer. And so the Moderna vaccine and the Pfizer vaccine both need a booster, the Pfizer 3 weeks afterward and the Moderna 4 weeks afterward. And they're both been very safe with very few side effects, very few problems, and they've been very, very effective. The newest vaccine is more traditional. It's by Johnson & Johnson, and it right now is a single vaccine. I say right now because there's always the possibility that in a year they'll say you need a booster of that as well. But those have been very safe, very effective. I think I haven't looked real recently, but people who have been vaccinated, there have been very few cases of serious illness and very few cases of anyone dying from COVID after the vaccine. But it's ongoing. We need to keep studying it and make sure people get vaccinated and then remain safe somewhat as well as they work through that. I'll explain that in a minute too. Any questions, Manasa or Calvin?
No, none from me regarding that. I think I've done enough research to understand it. And I do have one quick question. What type of pushback are you getting? What are people saying, and why are they afraid? And what can you tell them to help them not be afraid?
Sure. With a shortage of vaccines being available for everyone right now, we're not getting as much pushback. The people who aren't interested are just kind of staying away. But I can tell you what traditionally has been pushed back about vaccines, and some things that are really not true that people say about vaccines. First of all, for any vaccines that we're using for this kind of thing, you cannot get COVID from a COVID vaccine, just like you cannot get the flu from a flu vaccine, because it's not even the whole virus, not even part of the virus. It's a small part of the what's called the RNA in the virus that's given to you that tells the body how to fight it, and it's how to fight the virus if you get exposed to it. So you cannot get the disease from these vaccines. The thing that confuses people is sometimes after you get a vaccine, you feel a little ill. You feel a little achy. You feel a little sick. Like, oh my gosh, I must have got COVID from it. And the answer is no, you didn't. It's actually your body starting to use its immune response to create the cells and the chemicals that help you fight the virus later. So it just shows a healthy immune reaction. By the way, if you didn't get any kind of symptoms, that's fine too. We know some people have more symptoms than others, but it does not give you the disease. And I think that's the biggest concern that people have with getting vaccines of any sort, is that they'll get ill because of the vaccine. It's pretty rare. It's actually really rare. You cannot get COVID from the COVID vaccine.
Oh, thank you. Yeah, the facts, information that Kaiser Permanente and Special Olympics Southern California and other organizations is presenting to the communities, I think helps to alleviate any of those fears. So thank you for sharing that.
Can I say one? I want to say one more thing too, because I mentioned this too. Getting the vaccine helps protect you. There's still a little question about whether or not you get a mild amount of the COVID after a vaccine. Usually people don't have much in the way of symptoms if they do, but still concerned about spreading the virus. So the thing that has helped us the most are two or three simple things. One is wearing a mask. And we've talked about this in, I think, another meeting. I have masks here. This is the one, this is kind of a surgical level, we call them level 2 masks that we have here. But masks can be kind of fun. I went to the University of Texas. So I actually have, someone sent me a University of Texas mask. So I have that. I've got Kaiser Permanente masks. So it's kind of fun to start collecting these now and wearing them in public, and you're protecting yourself as well as protecting other people. The thing that has been a little controversial, these are like gaiters, the things you put over your neck and use them. They're probably not as protective of you or the people you're around. So when we're here at our vaccine site or at our medical office buildings, we tell people not to wear these, but to put on one of these kind of masks when we do it. And we give it to people to do that. So wearing masks is still really important. Washing your hands has always been important, though probably not a lot of transmission of COVID unless you touch something and then touch your face. So wash your hands frequently. That'll get rid of that possibility. And then still maintaining some distance from people. So not being in crowded rooms, crowded events until we get enough people vaccinated to where the virus goes away.
Fantastic. And I think, Manasa, were you asking something about wearing 2 masks or wearing a mask and a face shield? I thought that was.
Okay, well, I have a question. Like the mask, like sometimes if you wear the gator mask around, it doesn't let, sometimes when I wore it before and it kind of doesn't really make me breathe. I kind of have a hard time breathing through that.
Hard time breathing. Yeah. And so there's a couple of things about that. A mask that fits well it shouldn't restrict your breathing by very much. And they've looked at studies where they put monitors on people and they don't feel, they feel like they're having trouble breathing, but their oxygen levels are staying up and that kind of thing. So they're doing okay with that. It does make people feel kind of closed in when you have like a mask over your face, and you get used to it. It took me a little while when I started, going back to work and doing things wearing a mask. It took me a little while to do that and get used to it. But masks are, again, like I said, life-saving. Now we also here, like in our vaccination center, we have people who are out there seeing the patients, getting their vaccines. It's hard to tell. Some people could have COVID because you can have no symptoms of it and have it. So we're trying to be extra protective. And they're wearing a face shield as well. So face shield or eyeglasses or those things, because you could potentially, if someone coughed on you or coughed around you, get some by going through your eyes. So that's one reason we have people wear face shields as well. Double masks are kind of interesting. You know, we're having people double mask. Now, if they come in with a gaiter, we give them one of these masks as well to put on. And that's because the gaiter mask doesn't do as much good. So they put that over it or under it. But a single mask is probably sufficient for most things out in the public. So a single mask, you'd like one that has multiple layers to it, is better than having just a single piece of cloth. You can make gaiters safer by doubling them over, but that again does restrict your breathing a little bit more. So it's best to get some that have multiple layers of fabric.
Indeed. Well, thank you. And as we look at returning to activity, I know it's going to roll out where we have maybe 10 people together as soon as we get the okay to do so. And then we'll grow that up until we get back to full activity. If we're considering, maybe flying or having our athletes travel down the road, are there any special precautions that we would need to take, as you would think, over the next maybe 6 to 12 months?
Yeah, that's going to be a bit of a moving target, if you will. Vaccinations, again, very, very helpful in preventing disease. Airplanes actually have very clean air in them. They have filters, and they're actually really good. The issue being, of course, who you're sitting right next to before the air goes through the filters. So again, wearing a mask, washing your hands frequently. The times that you have to take a mask off would be to eat or drink something. So trying to avoid doing a lot of eating or drinking on a plane if you can, until this thing gets under more control. But again, if you have a long flight, you're going to have to eat. You're going to have to drink something, just being really cautious about it. But again, the masks and the vaccines are going to help with all that travel as well.
Manasa, how have you done with staying active and not being around all your friends and other athletes during this time?
I've been well. I'll be. Can I tell you the truth?
Please, I'd appreciate that.
That might sound harsh, though.
Okay, well, I think we can handle it. Can Dr. Rubin, are you okay with that?
Sure. Ask a harsh question. I'm ready.
Yes.
It's not a harsh question, but honestly, I've been very lazy. And but I've been exercising a little bit. I'll be honest, I did pick up exercise a little bit there and back, and I stopped. But most of the time, I've been watching TV and and during the pandemic, when COVID hit, it made me wanna. I learned more about myself. I learned I feel like COVID had changed me a lot.
You know what I've done? I use an exercise bicycle, a stationary bicycle, and I have to reward my television time by riding the bicycle while I'm watching television. So Hopefully something like that'll help. Or whenever commercials come on, you have to do exercise for the entire run of the commercial, and then when the program comes on, then you can go back to watching.
I am so sorry. It was a phone. I'm so sorry.
That's okay. They were calling you, telling you to make sure you exercise when you watch television. But we intercepted that call and told them to wait. That you were in a very important interview with Kaiser Permanente in Special Olympics Southern California. So it's okay.
Yeah, I think a lot of us, we play sports for fun, but we don't realize how much exercise we get in playing the sports, right? So Manasa, I think you were soccer. You said you were a soccer player and a swimmer, so you probably like doing that, as you don't think about how much exercise you get. So we have to force ourselves a little bit to go out. I've been walking more than ever, I'm on a lot of meetings, and luckily I can do most of my meetings, or at least a lot of my meetings, with a headset on and walking, even though once in a while people know that I'm out there because they hear traffic behind me. So, but there are ways to try to get that exercise done. So you just had to change things a little bit.
Yeah, but I'll be honest. But either on most days, and most of the time, I've been trying on days like sunny days like this. I've been walking around the park in my area.
Well, that's great. That is awesome. Yes, yes, I do the same thing. I walk, I enjoy the fresh air. I put my mask on and go out. And especially when I come close to someone, we'll give each other enough space. Someone will go into the street or go into a safe driveway and we'll wait and we'll pass each other to make sure that we're keeping each other healthy. So
Yeah,
lots of ways to get exercise
Yeah,
and help other people stay healthy.
yeah, people have been really polite, I noticed with that. The one thing, in fact, you mentioned this, Calvin, I think to point out is, we're kind of giving people a lot of space, but we need to be careful as far as, I've almost stepped in front of a person riding a bike because I was going on the street to go around someone
Oh my,
and that kind of thing. So
yes.
even with a mask on, just being aware of what's going on around you is really important to keep safe. And Manasa, didn't you tell me you're a swimmer also?
yeah, I'm a swimmer.
So swimming is a sport that people got back into pretty quickly. It's one of the first sports that people started to return to because, again, you're swimming usually kind of by yourself, right? I mean, you're not right up
Yeah.
near other people, so it's a good sport to get back into. So you got one of the better sports to start up again pretty soon.
Yeah.
Yeah, but right now I started swimming with the Special Olympics local program near to me. Um, right now we're not doing that, and the swimming center in my area is still closed due to COVID.
Mm,
Yeah,
understand.
hopefully they'll be opening again soon as they have less and less people with COVID coming up. So hopefully soon for you.
Yeah,
I know one of the things we're going to look at Special Olympics Southern California is how we can better engage with our athletes and how our Kaiser Permanente doctors and staff members can assist us with that. We love the passion that you have. When you come out, you're so, uh, I'm going to say, so deeply involved in what our athletes do, and you know us so well. So it's like having a family member come over for a meal. They know that they can go into the refrigerator and still feel comfortable. So thank you for helping us understand how not only your knowledge base and science base is going to be a part of this, but how that plays into the emotions for our staff members who see you coming and just celebrate the fact that you're there. We so greatly appreciate that. And we want to make it deeper and better. So if there's anything that we can do to make you feel even more warmly welcome, please let us know because our athletes and our staff members so greatly appreciate it.
okay, thank you.
You're welcome. Anything come to mind for either of you? We want to, as a staff, to be there for you. Anything come to mind immediately that you would like us to take a look at?
I know this has nothing to do with COVID or whatever, but I think it'll be great. If you like, I learned in Utah, they have a Special Olympics program in Utah where they partner up with it's like kind of like Best Buddies where they partner up with, they have an athlete that partners up with a person without a disability. And I think you guys should start that program.
I see. Yeah, the inclusive sports model. And we do have that in some areas, but yes, thank you. Thank you for doing that. And we can probably, hopefully, partner you with a Kaiser Permanente employee, doctor, who likes to do that type of thing. Again, I learned how to swim very late, so I'm not the best swimmer. If I fell into the water, I can save myself. But maybe that's something that I'll practice on as well, so that I'll be available to be a buddy, and hopefully it'll help me stay healthy. Dr. Rubin, how long have you been practicing medicine and what have you enjoyed most about it, especially as it pertains to Special Olympics?
I've been practicing over 30 years. I've been with Kaiser Permanente for 30 years. And I had some little practice about 4 or 5 years before that back in Texas. I'm from Texas originally. I really enjoy, I mean, one of the things that I'll tell you with COVID is I've been doing more administrative kind of work over the past year for a lot of it, and had not had as much contact with patients and athletes, and doing some more remote work kind of thing. So I really do miss the contact I had with athletes and with my patients. So I really like that part of my medical practice more than anything. And it's been a little different. We've gone, a lot of our visits have become more video visits and phone visits and those kind of things. And we're learning we can take care of a lot of things that way, but we still need to be able to come in contact and see someone and talk to them in person. So I miss that part of it right now.
Got it. And Manasa, how long have you been an athlete? Can you tell me a little bit more about your experience?
I've been an athlete since like I think 2002, probably like when I was like in elementary school.
Mhm.
I in 2000 I used to compete here also as a snowshoer when we used to have winter games, and I was the first one to be last for the winter games for doing snowshoeing for the Special Olympics World Winter Games held in Boise, Idaho.
Goodness. Is snowshoeing as hard as it looks? It looks very challenging to me.
Yeah, it was very challenging.
Yes. I prefer warm weather. So when they talk about snowshoes and they mention my name, I run away. I don't have all the confidence I need to
You
deal
know,
with really cold weather.
my dad, he cannot stand cold weather at all. Even if it's windy, okay, it'll be like a very sunny day, but if it's like a little windy, a little breeze, nope, he has to wear a jacket.
I love your dad. I like him. It was great to meet him too earlier in the call. But yes, I'm like that as well. That's why Southern California is my place to live now. I love it. I grew up near Chicago, where it can get very cold and very snowy. So when I moved here, I was actually making airplanes. So that's why I was asking Dr. Rubin about flying, because I knew about airplane filters. But I'm glad that they're getting even better since I've been now in the nonprofit world, and that sooner or later we can get back to getting athletes in the air to events. So thank you, Dr. Rubin, for sharing those facts too.
Sure. When I moved here, I remember someone told me, "Welcome to California, where the snow has the decency to stay in the mountains where it belongs." Unlike where I was in North Texas or in Chicago, where I have some relatives.
Yeah, snow goes where it wants. And even in Texas this past year, I know there were snowstorms. My son lives in Dallas, and Texas became the snow capital of the country for a few days. So it was good to be in Southern California. And one other question I was going to ask, it's been hard, I know, on our athletes and on me, to be even more transparent, to be confined. So is there anything from a mental health aspect that we should take into account as we begin to return? Any precautions, any things we should pay particular attention to make that transition more smooth?
So these kind of things help a lot, I think. Actually, it's not the same as being face to face with people, but it's certainly better than a phone call where you actually can see. I can see Manasa's reactions to things as we're speaking and kind of help react to them a little bit. So that helps some. I think it's going to be a bit of a slow process, and we need to be aware of that people may not want to be right up against each other, in a crowded room right away, and gradually increasing that social contact. I never cared for the term social distancing because I thought we shouldn't socially distance, we should physically distance, right? And keep our
Yes.
social distance to a minimum. We should actually try to continue to have social contacts. So that was kind of one of those terms that I thought it caught on early, but I think we need to continue to keep our social contacts going. I think one of the things that we'll be working with our medical staff on is, besides out there looking for people twisting their ankle or doing something like that, is make sure that people are practicing safely. So face mask when they're not participating, giving people, just kind of keeping people gradually into the full safe return to sports. It's going to be a little different approach for us, I think, as we start doing this. So, but no, I think physically, getting that physical distancing down and continue to increase the social contacts, the Zoom meetings, FaceTime, however you want to do that. But I think we need to continue to do that. We shouldn't be isolating ourselves.
Thank you for sharing that. And as CEO and staff member, my number one priority is athlete safety. So I look at Manasa on screen and I think about her at a swimming meet and maybe playing soccer. How do I make sure she stays physically safe? How do we protect our athletes? How do we protect our staffs and our volunteers? And one of the things I'm continuing to hear, Dr. Rubin, are vaccines and then variants. And we're almost out of this thing. Oh, now we're heading back in. What type of precautions should we take over the next, say, few months with all of the news that we're hearing about this? Anything to share, please?
Sure. So Vaccines are still looking like they're pretty good against all the variants. I say pretty good because there's still some evidence we need to get for that. But the way you get these variants is by having disease spread. So because it doesn't just change within someone, it changes as it gets from one person to another. So doing all of these things that we called, it had a funny term, it was called NPI, non-pharmaceutical intervention. So as opposed to a vaccine or a medicine or that, non-pharmaceutical interventions, which is why I keep talking about going back to masks. Masks, really are very protective. When I put on a mask, I'm protecting the people around me and protecting myself. And if the other person's doing it too, you can really reduce the chance of transmitting disease. If you don't transmit disease, you don't get as many variants. So I've been I'll admit, a little confused when they say that the variants are more contagious or more cause more illness, because if you can still prevent it by wearing a mask, by keeping your distance, by washing your hands, by doing all of those things, you're able to do that, you're going to prevent some of those variants from coming in. So I suspect the variants have been around here for a while, and we're seeing little outbreaks in different places. Fortunately, in California right now, it's pretty low, though I think we're going to see a little bit increase again as we open up more things. That's why I think we need to be cautious, but I don't think we're going to see the same kind of things that we saw in December and January, which were really, really large numbers of cases of people being very, very ill. So as physicians and medical community, we're better at treating it, but we now know that the best treatment is really prevention. So the less people who get it, the less likely there's going to be more variants, and the more likely the vaccine is going to continue to be effective.
Got it. And how can athletes get vaccinated? Where can they get more information?
So you've hit on a really hard subject, and depending if we're gonna, I know we're recording this, so if someone watches it today or watches it in a month, it's going to probably be quite different as we go through this. So as of today, there are certain tiers of people allowed to get vaccines or encouraged to get vaccines, and probably most of the Special Olympics athletes would be eligible for a vaccine. The thing is that right now, vaccines as they're rolling out, it takes a little while to get them into the stream and get vaccines. I always talk about turning vaccines into vaccinations. So you're turning the stuff in the vial into a shot that goes into someone's arm, and that's the vaccination. And that takes a bit of time to get everyone lined up to do it. Right now in Southern California, actually all of California, there's a website called MyTurn. It's myturn.ca.gov, and people can go on there and look and find open vaccine spots within, actually it'll show up, I think, within 50 miles of what address you put in. And it goes through the questions to make sure you're eligible for the vaccine. So if some people may not be quite eligible, the eligibility is changing. April 15th again, there's going to be changes in it, and the hope is that everyone is going to be eligible for vaccine by the 1st of May. Even though I think the President Biden has wanted to move that up a little bit to toward the end of April. So that's what's coming. It's right now, though, a matter of people kind of going on and finding spots to get their vaccine on MyTurn, which is available to everyone. Every county has a slightly different thing that you can look into as well. Vaccines, as I said, we have a mass vaccination site. Kaiser Permanente has vaccines at all of our medical centers, um, as well as many of our medical office buildings. A lot of the pharmacies, CVS, Walgreens, and several others are doing vaccines on site. Some of the counties have vaccination centers, some of the cities have vaccination centers. So probably the most consistent way is looking on myturn.ca.gov and registering for that, and then being persistent, because even today in our vaccine site, by the end of the day, we'll open some more vaccines, for a little later in the week. We have to do it depending on how many vaccines we're going to be given. So we don't want to offer people appointments if there's no vaccine to give them. So we're opening those things regular, and that's what everyone else is doing as well. So you have to kind of stick with it on the computer and kind of hit refresh several times until you can find a site that's close enough to you to get the vaccine. I also suggest one other thing too is, I know some people ask for specific vaccines. There's really no difference between them. I mean, you can find minor differences, but as far as being life-saving and preventing serious disease, they are all working that way. So the advantage of a vaccine such as Johnson & Johnson is it's a single dose. So you get the vaccine, and after 2 weeks, you're ready to go. It's a little more complicated with Pfizer and Moderna, because you have to come back for a second vaccine to have full effectiveness of the vaccine. So, but it just depends on what we get from what company that's released to the state and then released to us. So getting any of the vaccines is helpful and really going to be life-changing for people.
Fantastic, thank you. And Manasa, think about a year from now, please. What one or two things would you say first to your friends, the other athletes you've been working with before? A year from now, what would you want to tell them after we've gone through this and we've come out positively on the other side? Any ideas on what you share with them?
It's to share that, like, after all of this madness after all this madness
Yes, yes.
after all this madness, we can just enjoy every minute of playing sports that we love, enjoying every minute and second of our time with with our teammates, our friends, our coaches, and not to take anything for granted, and don't be upset when you lose a game.
Okay. Can you tell me a little more when you say not take anything for granted? What does that mean to you?
I mean, because you never know if it's ever gonna happen. You never know if you're gonna play the sport again. You never know if you might see those people again.
Wow, that's deep. Thank you. Thank you. That's true. And that's for all of us too, to never take any of this for granted. So thank you for sharing. And thank you, Dr. Rubin.
And rest in peace for Rayford Johnson.
Wow, thank you for sharing that. Indeed, our founder, yes, we did lose him late last year. And we will continue to honor his legacy by doing all that we can do to make sure our athletes are safe and healthy. And we continue this great work with partnerships like the one we have with Kaiser Permanente. Thank you all for being part of a great family.
Thank you.
I'm fortunate to be a new guy, and you welcome me with open arms, so thank you.
Thank you. Welcome, Calvin Lyons, again.
Thank you.